Yeah, we can go ahead and start. And then if we have a couple of folks jump on late, we are good to go.
Great, thank you. So good afternoon, everybody. With a quorum present, the Maricopa Regional Continuum Care Board meeting is now called to order. Please remember to mute when you're not speaking. Board members, please do not use the chat function as the audience cannot see what is being written in the chat function. Katie, please take a roll call. Members of the board, please indicate that you are here and the organization that you are with after Katie calls your name.
Tish Brown Gambino is absent today. Jacqueline Campbell.
Here, U.S. Vets.
Liz DaCosta.
Hello, Liz DaCosta with Community Bridges.
Marshall Franklin. Tad Gary.
Hi, Tad Gary with Mercy Care.
Lisa Glow. Chris Hallett. Sean Pierce.
Sean Pierce, Maricopa County.
Joan Service.
Joan Service, Arizona Housing Coalition.
Charles Sullivan.
Hi, Charles Sullivan, ABC Housing.
Jackie Taylor. Jackie is on, but it looks like she stepped away. Danielle Wright. Co-chair Ryan Balch.
Ryan, City of Chandler.
Co-chair Rob Podlogger.
Rob Podlager of Valley of the Sun United Way.
Back to you. Oh, we have a couple more people joining us. So Lisa, do you want to introduce yourself?
Lisa Glow here from Cass.
Thank you. And Danielle Wright.
Hi, everyone. Danielle Wright, Arizona Coalition to End Sexual and Domestic Violence.
Thank you. Back to you, co-chair.
Great, thank you. We're just finishing up roll call and we want to make sure we can add those who just joined in. The next item on the agenda is a call to the audience. Members of the public were given the opportunity to submit written comments relating to this meeting to azmag.gov/comment within 1 hour of the posted start time for the meeting, or can join the Zoom meeting by requesting the link from MAG staff. If you're wishing to make a comment, please raise your hand in the Zoom and you'll be invited to unmute at the time. Public comments are limited to 3 minutes. Katie, were there any comments received or anybody who has joined the call to offer comments at this time?
There were no comments received and no one has raised their hand at this time.
Great, thank you. Now we move on to the next agenda item. Our next agenda item is to approve the June 27, 2022 meeting minutes. Does any member of the board have questions or comments on the minutes? Seeing none, can I have a motion to approve the June 27, 2022 Maricopa Regional Continuum of Care Board meeting minutes?
Mr. Co-Chair, I'll second it.
All right. That was a race. So was it first by Danielle and second by Sean?
Correct.
Okay.
Yeah.
Great. Is there a discussion to the motion? And if not, then I'll ask Katie to proceed with the roll call vote. Please indicate clearly how you vote, stating yea or nay after your name is called.
Jacqueline Campbell. Jacqueline Campbell. It's my end or y'all's end? Liz DaCosta.
Yay.
Marshall Franklin. Tad Gary.
Yay.
Lisa Glow.
Yay.
Sean Pierce.
Yay.
Joan Service.
Yay.
Charles Sullivan.
Yay.
Jackie Taylor.
Yay.
Danielle Wright.
Yay.
Co-chair Ryan Balch.
Yay.
Co-chair Rob Podlogger.
Yay.
Did I miss anybody? The motion passes. Back to you, co-chair.
Thank you. Now we'll move on to the next agenda item. The next agenda item is the updates. Chairs of committees within the recent activity will be asked to share. Updates will also be provided in the monthly newsletter sent out by MAG. But before we jump into updates, I want to say thank you to Amy Schwabenlander and to some others who commented at the last meeting, bringing race equity into our board strategic plan. We are working to incorporate that feedback and want to be able to provide the updates as we work through the changes and develop next steps. So Amy and everybody who brought that to our attention, thank you for your attention to that. Now on to the updates. We will hear from board member Joan Service for an update on the Housing Supply Study Committee. Joan, take it away.
Hi, good afternoon, everybody. Yes, so the legislature has adjourned. One of the outcomes of this past session was a convening of the statewide Housing Supply Study Committee. And it is made up of many members, representing both the state and local level, but also many different industry groups. And the Housing Coalition is, pleased to be humbled to be part of that committee, representing you all as we advocate for more affordable homes for all Arizonans. I just wanted to bring to your guys' attention the opportunity to engage through that part through the study committee. The study committee meets the second and fourth Tuesday of every month from now, or from July until the end of the calendar year. However, with September, during the month of September, though, there will be a weekly roadshow across the state. I wanted to mention, and I know I can't drop into chat, but I wanted to mention there is an opportunity to live stream these study committee sessions, as well as to participate through public testimony. The next meeting obviously is tomorrow, July 26th from 1 to 3 p.m. And if you reach out to me, I'm happy to send you the live stream information as well as the tentative agenda of what will be discussed during each of these committee hearings. The committee hearing that will occur tomorrow is how do you build a home and the home building process. And we'll hear from cities as well as some home builders and the opportunity to have public testimony. I do know somebody in our field is I believe going to testify tomorrow, and that is Dee Dee from Native American Connections. And I'm hoping that we can encourage more folks to participate, especially since not the meeting that's happening tomorrow, but on August 9th, there's going to be a discussion about housing impacts as it relates to certain populations, marginalized communities and the lack of housing therein. So I think it's a great opportunity to engage folks in our field to testify. I've reached out to a couple of board members, a couple of MAG board members to participate in that process. So, this is an open call. If you want to be a part of that process, either please reach out to me, or anything I can do to help engage folks through this process would be most appreciated.
Joan, could you also send that to me and we can get it sent out to through the newsletter, all of that information that's going out next week?
Perfect, will do.
Great, thank you. Any questions for Joan? Oh, sorry.
Well, I would like to add one comment. And Rob, I know you were privy to this conversation, and I don't know when the appropriate time to bring this up is. And I know, and maybe it's at the tail end of the agenda, with a conversation about the SRP canals and having that discussion through the MAG board. That would be great.
Okay, great. Recommendation, I want to bring that up. Should we at the end?
Yeah, board members, this wasn't on your agenda, so this can be either a request for next item or comments from the board at the end of our agenda today.
Perfect, thank you, Katie.
Great, good call. Thanks, Joan. Anything else? I'm sorry to interrupt you. Great, thank you. Next, we're going to hear from Matthew Kelly with Mercy Care and Jusani Goodman with Phoenix Rescue Mission for an update on the Coordinated Entry Subcommittee.
Hi, everyone. I'll go ahead and start us off with our update. So thank you so much. Our first update is home base coordinated entry evaluation. They last were with us during our last meeting on 7/21 to basically gather ideas on an upcoming stakeholder engagement meetings, as well as appropriate subpopulations for focus groups, who were we missing, and trying to gather that information from everyone who participated in that meeting, as well as other community connections. So if there's any other social service providers or other just, I guess, interception points where individuals are potentially experiencing homelessness and how we can help them get connected to the coordinated entry system, or where there might be gaps. So basically trying to compile meaningful feedback for them to be able to complete their evaluation and implementation for the evaluation. The next update is that we're working on a housing restriction grid survey. So basically, we shared the idea with the committee as well as with the coordinated entry leads about the idea of exploring the housing first focus of different housing providers, specifically right now, permanent supportive housing. And we have a scheduled work group meeting to establish a survey that can be sent out to those providers to help identify their eligibility criteria and how we can align projects to basically the housing first model. So that way we can maximize prioritization and accessibility. And I'll shoot it over to Matthew for another update.
Yeah, thank you. So just quickly on the DV work group that we've continued to work on. So our next meeting is actually scheduled for August 11th. And actually, excitingly, we're going to be starting to work on the prioritization discussion, which we've already had one conversation on and has gone fairly well. So I'm super excited for what that's going to be looking like. At the August 11th meeting, we're actually going to have some data to actually review. So as of July 1, the DV providers have been submitting information to Solari for individuals who are interested in participating in coordinated entry. So we're actually going to have some data to review on what number of people are actually engaging with the coordinated entry system and kind of starting to feed into how we might prioritize that population for the resources that exist within coordinated entry. I think it's also really helpful to know that last week we were able to kind of twofold meet with the program managers of the domestic violence providers. We had brought home base to that meeting to get some feedback from that group regarding the coordinated entry evaluation. But in addition to that, it was an opportunity, I think, for us to kind of talk with them and kind of get some feedback from them as well on coordinated entry. As a result of that meeting, I think 4 different program managers will now be participating in the DV work group moving forward to ensure that the voice is definitely heard in that work group as we move forward on the prioritization of that project. So that's it. Thank you.
Great, thank you. Any questions? Okay, perfect. Do any other committees or subcommittees have an update at this time? Okay. Any member of the board have a discussion on this at this time? Great, let's move on to the next agenda item then. Kelly Williams with MAG will provide an overview of the supplemental notice of funding opportunity and the scorecards that will be used to evaluate the projects. Kelly, I'll turn it over to you.
Good afternoon, co-chairs and members of the Continuum of Care. I appreciate your attention this afternoon. As you know, we have been presented with an opportunity by HUD to apply for nearly $28 million for our Continuum of Care for a one-time funding opportunity. This is supplemental. It is in addition to our annual HUD funding opportunity. The supplemental NOFO, the Notice of Funding Opportunity, is for new projects, for HMIS, and for coordinated entry work, and also for supportive services. It's specifically to address the needs of unsheltered individuals with severe service needs. Those individuals can be any age. It is a one-time funding opportunity that begins in January of 2023. It is a 3-year grant period. So organizations that are funded will receive their funding one time, but it will be expected to be spent over those 3 years. It is not, you don't receive funding for 3 years in a row is what I'm trying to get out there. This NOFO is a little different than other projects because it is specifically targeting new projects, which we're really excited about. And we do have a launch meeting scheduled for Wednesday afternoon where we will be going through the details of the funding opportunity in addition to the timeline proposed for making sure we get all of our applications in by the October 20th deadline to HUD. We do have 3 scorecards for your review today. The first scorecard is specifically around housing and funding new housing projects. Again, this cannot be for acquisition or for rehabilitation, but it can be used to pay for vouchers, et cetera, for individuals who are experiencing, who are unsheltered again, and who have severe service needs. The second scorecard is specifically just for services. It's the abbreviation is SSO, but it is supportive services only. And the final scorecard is for HMIS projects. All of these projects have to have some specifics. Oh, thank you, Katie, for sharing your screen. Are you pulling up the scorecards? Yes, okay, thank you. All of these projects have some musts that have to be involved. The first is you have to follow the Housing First model to very specifically. We've sat in on several webinars, both from HUD and other experts across the field who've reviewed the NOFO, as well as we have, and identified some trends. Again, the first is Housing First cannot just be casual language that's added to an application. They are really looking for projects that follow the letter of the law when it comes to Housing First as a best practice model. The second theme that we heard consistently throughout the webinars and through also speaking with officials is that lived experience voices must be included in the process. They're really looking forward to hearing from individuals who've experienced homelessness and having them at the table when solutions are being proposed. Also, race equity is key to this application. HUD wants to see how you are involving the service needs of individuals who are BIPOC across our continuum, and again, including them in the creation and proposed solutions that you may be applying for with these dollars. So I'm not sure, I'm doing this a little bit differently today than I did at the Continuum of Care Committee meeting. I'm not sure how in depth you would like me to go into each of these scorecards. Katie, were the scorecards sent out to individuals in their packet?
Yep, it was included in the packet as well as attached to your calendar invite.
Okay, so we are open to any final edits or considerations that you may want us to take into consideration with these scorecards. Would it be appropriate, chairs or Katie or anybody else on the board, would you like me to go step by step through these, or how would you like me to share this information with you in the most time efficient and appropriate way? I'm willing to take any direction you may have.
I think Kelly, go ahead, Rob.
Go for it. No, go ahead.
I was just going to say, I think if you could, I think it's important because we're voting on it, and it might be the first time that a public member is seeing it and have the opportunity to ask questions. If you could just go through each of them briefly, I mean quickly, but okay. Go through each.
Sure. So the first one will take the longest. There's a lot of duplication between each of the scorecards because, as you can imagine, with HUD funding, there's a lot of technical language that has to go through all 3 scorecards. So I will spend a little more time on this first one. This is specifically for new housing projects for the unsheltered population. There are 3 different levels of housing that are eligible for this funding. It's permanent supportive housing, transitional housing, and rapid rehousing. Again, they're really looking for creative, lived experience projects that also have a racial equity eye for each of these. If we could go to the next page, Katie, if you could scroll down for me, please. So I did mention the Housing First model is key. Again, they are interested in having knowledge of your previous experience in utilizing federal funds. If you've had an audit, if you have not had an audit, all of that information needs to be included. If you could please scroll down, Katie. I apologize. I should have been prepared to share my screen. I'm sorry I didn't have this up. I appreciate you doing this, Katie. So what the things that we heard, not necessarily the things that are written in the NOFO, but what we heard from HUD officials, and we're trying to incorporate that in these scorecards, is they're looking for creative approaches to working with individuals who, again, have those severe service needs. And so it's with new dollars, who are the partners that you could bring to the table who haven't come to the table before? How can we creatively look at homeless solutions that we have not considered before in our continuum? And is there a way to incorporate a new approach to, for example, work with our chronic population, for example? So the design of housing and supportive services is key. Again, there's some standard language on how to make sure that you're pairing this individual with other appropriate services that he or she may qualify for, such as Access, SNAP, WIC, etc. Other programs and other supportive services that they may be able to be paired with. I heard again and again from the HUD officials that they are interested in seeing how Medicaid can be a partner in this work to provide some insight there. How can we increase the individual's incomes who are benefiting from these programs? For timeliness, again, there's some standard boilerplate language where they're looking for, how have you used, what is your plan if you receive your funding? What is your 30, 60, 180 day plan look like for if you are awarded? How are you going to roll out the project that you're proposing? Have you been audited by HUD, as I mentioned previously? There's a budget section, which again should not be surprising. So to answer some of the questions that we've heard from previous groups that we've spoken to about this so far, this is not for emergency housing necessarily. It is not for shelter housing. However, you could apply for these funds for the services that individuals who are in a shelter may need. So again, HMIS participation, coordinated entry participation are required by the grant. Racial equity, we intentionally made racial equity a higher scoring section of all three scorecards because we really want to see this reflected. We know that there has been some great racial equity work happening across our continuum. We know that we've been having multiple conversations about, again, how to have more parity for individuals who are homeless or unsheltered. So we want to see that reflected in your work as well. And I know I sound like a broken record, but the lived experience voice is critically important to these applications too. Katie, can we go to the next scorecard, please? So this again is supportive services only, SSO. You'll hear that acronym. I'm going to try very diligently not to speak in acronyms during this presentation, but this section is for service providers who are going to work with a homeless provider on providing the services that individuals who are unsheltered and have severe needs may need to be able to become successfully housed. So the first section again talks about how are you working with either the permanent supportive housing, rapid rehousing, or transitional housing provider to identify those supportive services and what are the services that you will be providing. And then again, there is 2A goes into more of the design of those services and how you're identifying what that individual needs, how you're making sure that the services you are providing are tailored to the individual and it's not a one size fits all model. And again, the timeliness, the audit, the budget, the inclusion of racial equity, keeping housing first in mind, all required through each of these applications and through the scorecard. One section I forgot to mention on the previous scorecard and on this scorecard, there is a match required by HUD for any applicant. We do have some specific language in both the scorecard and the application and how to show us that you will have that match in place if you are to receive funding when awarded. We do not need your immediate match financial information at the point of application, but you need to have that in the back of your mind. It is a requirement by HUD. And then finally, we have an HMIS project scorecard as well. And again, it's These are fairly repetitive, but tell us how you are creating a project with housing first in mind, et cetera, using HMIS and moving forward to use these funds. Each of the scorecards does total 50 points. We are in the process on our team of putting together a rank and review subcommittee to be able to review these when our timeline is announced. We do have a draft timeline in place that we're working on internally. We're not prepared to share that with you quite yet, but we will have those details ready to go on Wednesday when we have our launch meeting, and we will have the application ready for you on Wednesday as well, all 3 applications, one for each of these sections. I know that is a lot of information. I appreciate Katie including these in your packet and on the meeting invite. I am available for any questions you may have. Vice Chair, or excuse me, Co-Chair.
Great. So just clarification, in each of those, I saw a point for timeliness of audits. And is that an audit of the your organization currently, or going through this process to be able to have it audited and looking back?
The ask is if you have previously received HUD funding and you have been audited. Is that correct, Katie?
No, the audit would be just like your typical audit as a requirement of a nonprofit or as a government entity. If you spend a certain amount of money over $750,000, you need to have an audit done, including your HUD funding. If you typically every 501c3 will have just your standard audit, and if you are not required to do an audit by the federal government, then producing your budget actuals and estimated for the last 3 years. So it's really just, we want to make sure that you're a sound financial organization. It's not focused on HUD dollars specifically within the continuum of care. If you've received continuum of care dollars in the past, though, that will be part of that HUD audit, or part of that audit as an organization.
Thank you, Katie.
Got it. Okay, that makes sense. I have one other question before I throw it over to Ryan. Was there anything surprising to you going through this process that there was an aha moment compared to some of the others that you've completed?
Well, I'll tell you from my perspective, I mean, the obvious is, it feels like cruel timing that they would decide to put out both of these NOFOs so closely to each other. And, you know, we're in a much better position at MAG with our continuum, in that we have a fully staffed team and we have multiple people working on this. I sat through countless meetings with folks who have one full-time staff person in some of their continuums, and they're now looking at applying for 2 NOFOs. So I would say the timing is questionable at best, but it's better to have the opportunity any day than not have it at all. I think it's interesting to have funding for new projects. It feels like the ability to pilot something for 3 years and be thinking about how we can really look at this differently than the annual funding that typically the continuum is bringing down. That's my
Co-Chair
perspective.
Potlager, I'll add to that too, that these scorecards are really a combination of your previous new scorecards and then the scorecards that we presented you for the annual 2022 NOFO process. So really this is, I don't think we necessarily like reinvented the wheel by any means on these, except to having it be more focused on unsheltered population and really changing the language to be that, having the focus of lived experience, and having race equity, which are all 3 things that this NOFO requires and that we highlighted in these scorecards with points associated, if that helps in reviewing these for approval.
Great, thank you, appreciate that. Ryan?
Thanks, Rob. And maybe if this is a better discussion on Wednesday when we do the full launch, this is less about the scorecards and more about 2 things I'm perplexed about this NOFO, but I know that you guys have been attending webinars with other COC staff, and I've only skimmed the NOFO myself. So, but if you have clarification about these 2 items, I would definitely be interested. The first is that as I am reading it, while it's one-time funding for 3 years, it seems like it could still be renewed, maybe not in a renewal, same kind of renewal process as we use now, because we increase our base allocation when we get new projects. So I get that it might not be that kind of renewal, but it seems like it could be applied for again. So that's the first thing. Are you reading that different?
Chair, so that question has been asked several times, and the answer that the HUD officials gave was the way they were able to fund this were from previously unspent Continuum dollars that were pushed out to HUD that they have recouped. And so they were pretty firm in saying this is a one-time thing. We're going to see how it goes and we'll get back to you.
Okay.
I think at this point, as a continuum, we should plan on this as a one-time funding opportunity. And if it's successful, I would imagine HUD will be asked by multiple continuums to possibly look at recouping and funding this again in a similar fashion. But for right now, one time.
Okay, thanks for that. That actually is helpful. And two other things actually. So I had three, I'm sorry. So the next thing is I'm super perplexed on why an applicant would need to apply separately for an SSO and a project to support permanent, transitional, or rapid. Why in an innovative project to address unsheltered homelessness, you would not want to have a direct line between outreach and the housing that needs it, not in terms of acquisition or development or even emergency shelter, but paying for hotel vouchers, paying for entry into detox, paying in for all the kinds of things that outreach goes to, especially when you're trying to have a housing first, when they're driving you towards a housing first model. So are you positive that you would have to apply separately for an SSO and a support of any of those housing interventions? That's just not making sense to me.
So let me give you my perspective and then Katie can correct me.
Okay.
What I will tell you is my understanding is the reason HUD set this up this way is that each community is bringing different resources to the table. Some communities need one of these three buckets. My understanding is if you are let's say that you run a rapid rehousing program and you have a partner who does supportive services, you can come together on your application and apply for the first section where you're going to describe how the program comes together. Katie, feel free to jump in there.
Yeah, your housing project can always have SSO, but Ryan, I think, I don't want to get too in the weeds here because a lot of these questions will get answered on Wednesday, but some of the things that you just mentioned as far as outreach are not eligible expenses. So within a HUD grant. And so if you're truly just doing when you have SSO funding within your housing project, it really should be managing people within housing versus this is the first time HUD has actually granted SSO allowable for outreach costs. That has not been an eligible expense previously. And so in the way, and this could be an oversight by HUD, but my understanding in these applications is they do have to have, you either are doing an SSO project or you're doing a housing project. There's not a way in the application that HUD has built in eSNAPs to have those be in the same project and have flex funding between those two different buckets. If you were thinking about doing it as a joint project, you could say in your application, we are applying for an SSO and we are applying for a PSH or some kind of housing project. And in order to make these both, like, we want the committee to consider these as being intertwined because people are going to go from this outreach project to this housing project. Does that make sense? I see you nodding your head, so I'm going to say yes.
It makes sense. I feel like this is a lack of foresight on HUD's part to not combine this when they're asking for new interventions for people who are chronic. And so I'm going to internally struggle with that, but I'm just wanting to figure out the best way to actually integrate those, or certainly two projects could partner. But I think a best practice would be to have them integrated. So I'm just trying to work through that. So any additional information that you guys hear about that would be helpful. And then the last thing is the mention of new stability vouchers. in the NOFO, I thought was interesting. To be released in 2022. Has there been any discussion in any of the webinars about that? Did anybody else catch that?
Yeah, so there are 4,000 vouchers being released. The public notice has not gone out to public housing authorities as of late last week. I have not heard differently that it went out today, but I could be surprised. And so we are still waiting to hear what do those look like. Our understanding is that they're going to be structured similar to the emergency housing vouchers, with the need to be interconnected between the work of coordinated entry. I don't know if it will be like quite to the requirements that the emergency housing vouchers required, but that is the indication of how they're setting them up right now.
And did you get a sense that they would like you to include I mean, they mentioned them in the NOFO, so I'm getting a sense that a connection to those those stability vouchers would be appropriate.
Yes, definitely appropriate. Still unknown as to how many like Arizona or even Maricopa County region would get. But there is a heavy emphasis and need to be interconnected with other housing options that are outside of our system. So mainstream vouchers, affordable housing development, all of those things, and a strong connection with health agencies. So whether that is our healthcare for the homeless or hospitals or our insurance plans, whatever that looks like, those are both highly urged in this plan.
All right, thank you.
Great, thanks. Tom Pierce.
Yep. Just a really quick question. When we've talked about some of the smaller organizations having an opportunity to compete in this process, has there been any consideration of the partnerships between organizations to support them in that capacity building? I know a lot of the smaller organizations, when they go after these types of opportunities, struggle with the reporting, struggle with a lot of the other requirements for application. And I didn't know if this would be an opportunity for them to find a partner to co-apply for something along those lines. I don't even know if that's appropriate in this way, but I just thought ran through my head. Thanks.
Well, you bring up a great point, and that I should have mentioned that another way this NOFO is different from others is that it does require quarterly reporting. So there is a heavier lift in reporting on this. At this point, we have not discussed technical assistance to help smaller organizations with their application, but we of course always encourage participation and collaboration among organizations helping each other. Katie, do you have anything you'd like to add to that?
I think we'll have a better idea too after the session on Wednesday. Really encourage anybody even interested in applying to attend that session. It's going to be a 2-hour, what is eligible, what is not eligible, how can we help you, kind of giving you the 411, for lack of a better description, of the grant as a whole, and really can provide some of that technical assistance after that session for folks with questions or challenges.
Great.
Liz?
Any follow-up, Sean? Good. Liz?
Yeah, I think this is great and why it's so important that we have a board strategic plan, because it seems like 3 years of funding is a perfect opportunity to kind of highlight how individuals can apply for funding that might further support the board strategic plan or even the regional action plan. So I just wonder, for the purpose of the scorecard, if it's possible for us to add any kind of points for projects that align with either plan. And the reason why I bring that up is I heard that you can fund support services through emergency shelter, but if our goal is to increase shelter beds, then finding a project that finds funding for increasing the shelter beds and supporting the project through this NOFO would be something that we would score higher.
I think that's a good point. I'll have to regroup internally with our team to review that, but I think that's a great suggestion. I appreciate you pointing that out.
And the last thought on it is, with the funding coming out for HMIS as well, there's likely opportunity for us to even consider having projects pair with our board strategic plan. We focus on system performance measures. So if we do a 3-year pilot that focuses on targeting a specific system performance measure through this funding, maybe there's flexibility for HMIS to come in and do some kind of specialty reporting or something. So I think essentially, like, how do we make the best use of this funding opportunity by building something in the scorecard that would score projects higher for kind of combining that thought process?
Liz, in the last year, we incorporated the regional action plan within the interview questions, and having people respond during the interview questions. Do you have any thoughts about that, of incorporating this into interview questions instead of in a written response that would have a scorecard? Throwing that out there.
Yeah, I think, because obviously probably quite a bit of work to go into updating the scorecards to try to factor in what I just said. So if we do have then rank and review and they hear in the interview questions, and that would allow for them to make a decision, I think, based on that. But if you have another project that scores higher, but the interview questions show that this other project aligns much more with board strategic plan or regional action plan, it might put us in an interesting position. So I just kind of wanted to throw it out there as a thought. I'm sorry that I hadn't heard all these details about it being 3 years prior. So however it best fits into whatever MAG needs to do.
Well, I for one appreciate your grace in that, because I think as long as we're addressing it, it will not be as heavy of a lift to go back and change the scorecards and change the application at this point. If we can address it through the interview questions, if that meets your need.
Yeah, I think that's perfect. We'll address it through the interview questions and rank and review.
Thank you.
I will add that you all have not, this is going to get sticky, so let me just say that first. But you all gave direction on the kind of what is on the table and not off the table as far as direction to the rank and review subcommittee for our annual NOFO. So one of the directions that you all could give as a board for this supplemental NOFO is alignment with the board strategic plan, and this interview question then could have a higher weight than just straight scores in going to this rank and review panel. We are still in the process of figuring out who is on this rank and review panel, and also who of you all is, a lot of you or your agencies are going to be applying for this funding. So how do we get an unbiased group who is giving voice to points or not points on rank and review is also challenging, because this is such an open notice of funding opportunity. So that is also kind of an option that we should weigh and consider. And we'll be working with you to establish a work group to give direction once we know who of you all is applying for that.
And to add to Katie's point, we're also looking to have individuals on rank and review with lived experience, and to have it be a race equity focused group. So it is, so we're very interested to see your letters of intent. And we will be announcing that deadline or that timeline again on Wednesday. So then we can go back and try to recruit the right voices to this rank and review committee. That's where a city of 5 million people all of a sudden feels very small.
Noted. Thank you, Kelly. Any final questions? A lot of work, a lot of attention to this. Kelly and Katie, thank you for presenting the information. So with that, I have a motion to approve the 3 scorecards for the supplemental notice of funding opportunity.
So moved.
John's first.
This is Liz, I second.
Liz second. Thank you. Is there a discussion of the motion? And if not, now I'll ask Katie to proceed with the roll call vote. Please indicate clearly how you vote, stating yay or nay after your name is called.
Jacqueline Campbell. Liz DaCosta.
Yay.
Pat Gary.
Yay.
Lisa Glow.
Yay.
John Pierce.
Yay.
Joan Service.
Yay.
Charles Sullivan.
Yay.
Jackie Taylor.
Yay.
Danielle Wright,
Yay.
Co-Chair Ryan Balch,
Yay.
Co-Chair Rob Podlager.
Yay.
Did I miss anybody? The motion passes unanimously. Back to you, Co-Chair.
Thank you. Let's move on to the next agenda item. A work group met over the past few weeks to make changes to the board charter. I'm going to turn it back over to Katie to provide an overview of these changes. Katie?
Thank you, Co-Chair Podlager. I'm going to attempt to share my screen again to walk you quickly through the charter updates and everything that is to come. So quick overview, across the entire Continuum of Care charter, we added inclusive language on pronouns. So anywhere where it said him, her, we also added them. We added ethnic diversity to racial diversity. So last time when you passed your charter, you added an emphasis on racial diversity across all of your boards. And we'd been operating under the guise of both racial and ethnic, but to get crystal clear, we added both racial and ethnic diversity. And then the last thing we did was update the formatting and spacing, just a little here and there, grammar and things like that. One of the things that part of the board strategic plan brought up was changing equitable outcomes to have stronger language. So wanted to get feedback on this to change equitable outcomes to say, we provide person-centered services so each individual and household can end their homelessness with consideration of race, ethnicity, age, gender, sexual identity, disability, and life experiences. This was language that initially said we provide individualized services so each individual and household can end their homelessness regardless of barriers. So this just became much stronger, really identifying some of the places where we wanted to have equitable outcomes. So I'm going to pause before I go on and see if anybody had any feedback or thoughts on this. And if you all just sit and stare at me, that's okay too. Okay, the next thing is we updated your membership to reflect the February changes that you all had of geographic specific municipalities. So this really added in the language about having a West, Central, East, and regional government seat. You all had approved this language, or you had talked about this language, I think, quite a bit, and then we actually added it and are accepting it into the charter. We also added a selection process for both the West and East Valley to select the board representative. We worked with the East Valley and then checked with the West Valley, and that is kind of, they have been using the same process of coming together to pick a representative moving forward. And then finally, we added a required number of board seats, creating a minimum that would require board recruitment and language about when board recruitment happens. So I'm going to show a chart on this next page, but basically what this says is that you all have a range of board seats. For example, you have a COC funded provider representative, which was 1 to 3 before. If you all fell below those 3 seats, we would mandate, or below 1 seat of those 3, we would mandate recruitment right away. And so this basically says that if you are losing seats, we want to make sure that you still have representation of that seat. So there's also the maximum number of board seats is really identifying that range. So when you all do recruitment, you have a range of how many seats should be in that range. And then finally, just kind of like a note on this, you'll see an asterisk next to the ESG representative. That is typically filled by your geographic specific municipality, which is why you have such a wide range up to 4, but typically you only have 1 or 2 on the board. Any questions about this before I move forward? Okay. One of the biggest refinements came from the data subcommittee. They spent quite a bit of time reviewing their pieces of the charter and did a refinement of their overview. The purpose of data subcommittee is really to oversee the work of HMIS. Similar to the coordinated entry subcommittee, they are really focused and honed in on the work of HMIS and making sure that those policies and procedures are being followed across our HMIS system. They are creating a sub-working group off of them that is focused on data analysis and policy recommendation. that is really going to be focused on doing some of those deep dives into data that you all were hoping that data subcommittee was doing. So that work group will be forming in the next month or so and really be able to deep dive into some of the system performance measures and who are the outliers that we need to get quickly housed that are driving our system performance measures up and things like that. This will also be, itemize some other things in your board strategic plan that is going to go to this work group. Finally, they updated their membership numbers to match other subcommittees and added the federal reporting, so reviewing the point in time count and the longitudinal system analysis to their roles and responsibilities. We are adding a local jurisdiction subcommittee to the governance structure. This has been kind of a work in progress that has really been overseeing the work forward of Pathways Home. So this work group this subcommittee will report, make recommendations up to you all, and it will be lateral to the other committees, becoming 7 instead of just 6. We added the language to reflect all of the other committees, meetings, participation, code of conduct, all of the membership structures and things like that. The one big change with this is that every local jurisdiction will have a designated seat on the subcommittee. This is something that functions similar to other MAG committees. So if you are a MAG member agency, then you have a seat on this committee, and is really going to carry forward the work of Pathways Home and some of the things that impact local jurisdictions on a greater level. This is something that I think will better integrate the work of Pathways Home with the continuum of care and how we are addressing homelessness on a regional level. The rank and review procedures, you all adopted these in June, and really it is just updating that language. As a reminder, it expands that list of options up to 7 instead of 3 with 1 recommendation to the board, and the supplemental NOFA will follow these same rank and review procedures. There are some logistical changes with dates, but that was about it on those, and you all saw those in June. And then finally, I want to just do a brief teaser of what's to come between now and August. There's a few additional changes that we anticipate that just were not able to get finalized before this meeting. Naming of subcommittees and committees to create consistency and uniformity across those. So those are all lateral committees, and making sure that that's understood across our continuum and that they are working together before ultimately bringing recommendations and policies up to you all. And then the addition of an additional subcommittee or committee that is really focused on race equity and the work that we all are doing through the race equity plan. This was a recommendation that really came out of reviewing the board strategic plan, as there are things that in different areas that we want to continue to bring equity into the fold. And so that may result in a subcommittee coming to you all for approval in August. Any questions about any of those or places of feedback from you all?
Katie, I have a clarifying comment.
Please.
There's only one committee, and the rest are listed as subcommittees. So that's your comment, correct? We want to standardize that going forward. DOC
Correct.
Committee and the others are listed as subcommittees. Okay. Any other questions for Katie? Or any questions for Katie? Great.
I didn't
thank
share
you.
my
Can I
screen
have a-
during that entire time, did I?
No.
Sorry,
You were
friend.
having technical issues. That's okay. I thought you were having technical issues. I didn't want to call it out. But appreciate it. So with no questions, can I get a motion to approve the changes to the board charter?
So motion. This is Tad.
Tad? I have a second?
This is Jackie, second. Oh, this is
Go
Jackie,
ahead.
second.
Jackie, second. Thank you. Is there any discussion about the motion? If none, Katie, I'll let you proceed with the roll call vote.
Jacqueline Campbell. Liz DeCosta.
Yay, and sorry, real quick, but thank you so much, Katie. I attribute a lot of this checking the boxes to your organizational skills. So great job. Yay.
Thank you. Tad, Gary,
Yay.
Lisa Glow,
Yay.
John Pierce,
Yay, it is a member of the subcommittee. Thank you, Katie.
Joan Service,
Yay.
Charles Sullivan,
Yay.
Jackie Taylor,
Yay, and I would also second excellent work, Katie. We are so fortunate to have such talented staff.
Danielle Wright,
Yay, thank you.
Co-Chair Ryan Balch,
Yay, and same. And also I wanted to step back to the NOFO scorecard also. There were many meetings for both of these items, and thank you to everyone who participated. A lot of work. Katie summarized and Kelly summarized these things super quick, but a ton of work went into both of these items. So just thanks for everyone who participated, and yay.
Co-Chair Rob Bodlager.
Yay.
The motion passes unanimously. And I will just say a huge thank you to the work group. I gave them homework between meetings, and they definitely showed up and had a lot of great feedback. So it would not be where it is without their help. So I will send that back to you, Co-Chair.
Great, thank you again. Thanks for all the work. And so let's move on to the next agenda item. Stephanie Crum, HMIS Manager with Solari Crisis and Human Services, will provide an overview of the system flow dashboard. Stephanie?
Hello, thank you, co-chair and members of the board. I'll wait till this gets pulled up here. All right, if this is the first time you're seeing this dashboard, I just wanted to point out again that on the first page, we do have some definitions here and inclusion criteria, so you can research what the definitions mean, what we're talking about when we talk about inflow, outflow, and then how somebody gets on and or off our active by name list. Let's go ahead and flip into the active overview. All right. Give a second to think here. Come on, Tableau. Oh. There we go. There we go.
Not sure if it's Tableau or my internet, so sorry about that, friends.
There we go. Perfect. All right, so as you can see here right away, our total number of active households is rising as we head towards our typical historical August peak. It is, as a term of numbers, it is being driven by singles just because that's a larger population. But I do want to point out, because it is sometimes kind of hard to see the movement of families down there. Percentage-wise, both of these populations are seeing increases. Singles about 8% and families 10%, but just because of the sheer number of the population, the active number is being driven right now by singles. If we scroll down here to the subpopulations, you can see right away that two of our hardest hit, I guess our most affected populations right now are the BIPOC, Black, Indigenous people of color, and then the unsheltered population has started to rise. Historically, these two populations do track pretty parallel, so that's not a surprise, but it is concerning being that the summer heat is nowhere, the end is nowhere in sight, and our unsheltered and BIPOC populations are climbing. Again, it's kind of hard to see with these lower lines any significant increases, but I do want to point out the youth number, which is that gray line down there. They're experiencing a 12% increase just over this month. So while again, the numbers might not seem very impactful for the youth population, that is the sharpest rise out of all of these subpopulations was the 18 to 24 category. Are there any questions about subpopulation or overall active numbers before we move on?
There is a question from Lisa.
Yes. Wanted to ask about the elderly. What is the percentage rise in the elderly? And how do you define elderly at what age?
Yeah, so the elderly population, if you flip over back to our definitions page, which you don't have to do, Katie, but if you do, that is, it should be actually down here. Yeah, that is 62 plus. So anybody who's experiencing homelessness right now who's 62 or older, they are seeing a 7% increase, so not very far behind, the other populations. Both white, chronic, and elderly were all 7%, where BIPOC and unsheltered was 9%, youth at 12%. We did see a small decline in veterans, but again, I caution against any assumptions right now, as we are still aligning our by name list with the VA's by name list. So we're going to see some fluctuations there until we come into complete alignment.
Thank you.
Yeah. All right, over to our flow details page. Let's see, give it to load here. All right, so again, at the top, you're just seeing the overall representation of the active number. As you look down, you can see our inflow versus outflow, and our inflow is the orange sort of spike there, and it is definitely outpacing our outflow. So we have far more coming into the system than we do going out on this during this month. If you flip down to inflow detail there, it just tells you a little bit about where those folks are coming from. If it's return from an active or new client. Both are rising, but this does seem to be driven a little bit more by return from an active, which means that folks who fell out of the system, were inactive for a period of time, have resurfaced. This tends to happen in the summer months with the opening of some heat relief shelters, which tend to be a little bit more low barrier. So we do get some folks who may have exited the system come back in to receive some heat relief services. And if we look down at outflow detail, looks like pretty steady as far as total exits. The housing number did go up a bit, which again is something to celebrate, any kind of rise in housing. But our unknown negative exits are pretty stable. I want to say they rose just a tiny bit there. Yeah, they're actually pretty stable. I think we had about a 10% increase, yeah. Does anybody have any questions on inflow, outflow details, or any questions overall? All right, thank you so much, co-chair and members of the board.
And board members, I just want to remind you, we're bringing this to you the month before we bring forward the homelessness trends report. So next month, you'll see Q2 of the homelessness trends report, which will include all of this data.
Great. Thank you. Thank you, Stephanie. Appreciate the update. And if there are no comments, let's move on to the next agenda item. I'm going to turn it back over to Katie, who's going to give us an overview of the Homelessness Management Information System evaluation and next steps.
Thank you, Co-Chair Podlager. I just wanted to share a quick update on the Homeless Management Information System evaluation. So this is part of Pathways Home, and we do have a funder for the first part of this analysis. We are contracting with ICF to do this evaluation. Just want to share kind of where we're at in the process. We're hoping to have this completed by the end of the year. And so wanted to keep you all updated. That contract will be signed between Solari and ICF in the coming weeks. And then after that, we will start kind of full blown into that evaluation. Don't be surprised if you or your staff get outreach to participate in that evaluation, because it is going to be at the system level, but also at the user level, to really understand how our vendor of WellSky interacts and whether or not there are other HMIS vendors that we should potentially be investigating, or really leaning on the work within the LAPS project, which is that data warehouse, to do some of this work under our HMIS guys. So just wanted to make sure that you all are still fully aware of that work moving forward, and I'm happy to answer any questions on that.
Great, thanks for that. If there are no questions, then we'll move on to the next agenda item. Oh, look, it's with Katie. Katie's going to provide us an overview of the progress on Pathways Home, including timelines, partnerships, next steps. Katie?
Thank you, Co-Chair Podlogger. And this time I figured out how to share my screen, so you all should be seeing this. Just want to give a quick update. One of the things that you all shared with us is that it's really helpful to understand the updates on Pathways Home prior to us going to Regional Council and Management Committee. So we will be presenting to Regional Council and Management Committee in August. And I'm actually going to split this presentation with Co-Chair Balch, as she will be providing an update on some of the continuum of care work that you all know is happening, but making sure that there is a streamlined connection between you all and Regional Council. I'm going to go ahead and jump on in. A quick update of the overview of the presentation. We will be providing an update on the continuum of care and the updates that are happening with that, the progress made on Pathways Home and next steps, as well as upcoming meetings. So with that, I will hand it over to you, Co-Chair Balch, to provide an overview of the continuum of care updates.
All right, thanks, Katie. I want to make sure I'm on the same slide as you are. So there we go. And so for those of you here today, like Katie said, our goal is to start getting this information before the continuum, before it goes to MAG, Regional Council, or Management Committee. So bear with me, I'm giving an overview of the continuum of care today, sort of in preparation for doing that at those in those venues later this month, or later next month, I should say. So this is going to be a little bit repetitive for you today, but hopefully in the future it won't be. So next slide, Katie. So as you all know, each summer, the U.S. Department of Housing and Urban Development releases a Notice of Funding Opportunity, which we affectionately call the NOFO. So this past year, we received over $35 million, which funds 32 programs in our community. And this was an increase of 2.7 million over the previous year, which is huge. These programs support more than 2,100 beds in our community. It's actually 2,198 to be exact, all across Maricopa County. And last year, we received the highest score we have ever received in our continuum. And that's really in large part, not in large part, in all part, to the excellent work of our provider agencies, which is showing really strongly through in our application, and also the collaboration of all of our regional stakeholders who are doing this planning and coordination and all the work it takes to not only get in our application every year, but also do all this planning work, the type of work that we're engaged in today. And of course, to MAG staff who just prepared an outstanding application this year, taking everything we do and putting it on paper articulately and in a way that really shows our progress and success. So you can all, thank each other and ourselves for all that amazing work that resulted in that application this year. And as a result of having scored so high this last year, we received 3 additional projects, which resulted in 57 new beds in our community, which is great. We also saw an expansion of our HMIS database project, which furthers our data analysis work. So great work was done by all this last year, and we anticipate the same level of work and partnership moving forward. So at the end of June, HUD announced, we've talked about this a lot today, our supplemental NOFO, which is specifically in our case, focused on unsheltered homelessness. There's also a rural set aside in that NOFO, but that doesn't apply to us here in Maricopa County. We are in the midst of working together as a continuum, providers, stakeholders, jurisdictions, all partners to determine what kind of applications we want to bring forward in our community. And we have the potential to bring an additional 28 million to our region for this important work. So as I mentioned, partners and providers across our region are beginning to have discussions and develop projects to put forward for our application. And so MAG staff will be reaching out to you and your staff to strengthen this application for our region. Even if you're not an applicant, everything we do in our region counts when we talk about our performance, our system performance, and how we work regionally. for success. So you can expect some information about your organization or your jurisdiction to be included in this application. The application is due at the end of October. So the Continuum will be working very hard to get this work done. Next slide, Katie. From a policy perspective, the Continuum of Care is very excited to launch a new subcommittee, or as those of you who are participating in our discussion today, we're looking at how we go forward in terms of naming subcommittees, committees, but there will be a new group that will elevate the voice of local jurisdictions. We've been working hand in hand. The Continuum has been working hand in hand with jurisdictions for a long time, but more closely than ever this last couple of years. And like many subcommittees in the MAG system, there will be one designated seat for each jurisdiction and also a proxy. And we anticipate that this subcommittee will be official in August. Next slide, Katie. So I also wanted to highlight today some of the work that is being coordinated between our Continuum of Care and the Pathways Home Plan to End Homelessness, which you are all a part of and a part of approving. So we are in the midst of completing evaluations both for HMIS and for coordinated entry. We talked a lot about that today. Both these systems are required by HUD. We expect to finish the first phases of these evaluations by the end of this year and begin implementing changes in early 2023. We've also finished mapping the homeless outreach activities across our valley, and we're beginning to really better coordinate those efforts. And we're looking at aligning policies and procedures to impact our outreach across the valley positively. Katie, next slide. And finally, to highlight some of the work we've been doing around toolkits in our region. We have completed the development of the first one, which is the Interdepartmental Teams Toolkit, and it focuses on how jurisdictions can either start interdepartmental teams or grow the work that they're doing around interdepartmental teams. There's many jurisdictions in our region have utilized this tool, this interdepartmental team tool, to really coordinate the efforts of people in different disciplines and certainly across jurisdictional departments. Just by way of example, in Chandler, we have an interdepartmental team. We call ours IHOT, Interdepartmental Homeless Operations Team is actually what ours stands for. And it ensures the coordination across disciplines and departments. And I really hope that this tool will be useful to those jurisdictions who would like to start a team or who would just like to utilize the tool for additional ideas or to grow the work of their interdepartmental team. You can see a little picture of it there on the slide, and that's, I think, already available on the MAG website. And we are also working on some additional toolkits as part of our Pathways Home work. And so one will be on the implementation of homeless specific specialty courts. Another will be on how to engage faith networks, and yet another on communication planning. So I hope that those will all be helpful to all of us in that work. And I believe with that, I'm going to turn it back over to Katie for to highlight some steps made in our action plan. Katie.
Thank you, Ryan. As many of you have seen before and will continue to see, this is a graph of what steps are underway and what are ongoing, and you will continue to see this over the next 5 years. And I'm just going to highlight a couple of key steps over the next few slides. One of the big things to know is the letters of commitment. Appreciate all of the work that is happening with local jurisdictions, and this number is continuing to tick up. I just updated this slide about 30 minutes ago before this meeting started with the contributions to local jurisdictions. You will see a slight decrease in contributions. Here it looks quite a bit larger than it actually is, just because we've not received all the letters of commitment. But there will be a decrease in contributions comparatively to 2021, 2022. The biggest reason for this And those have multi-year, so they've been down at this point, but were in that first year. So we're going to continue to see that fall off as that federal funding is used up. This
Katie, you're cutting in and out, so it might be good to go off camera. It might help with what we can hear.
And so you
Can't hear you, Katie.
Can't hear you.
well,
I'm
not talking. Okay. So the next thing is going to be the reassessment of housing targets. So wanted to share with you all, when we initially created the plan, we set an analysis looking at 1 year and then projections for the following year. And we've changed this methodology to really start looking at this on a quarterly basis to really understand what is actively being used in our community and what has already been kind of released as they come online. And then also looking at how we use those moving forward. We still have a goal of reducing homelessness by 25%, and that's where these numbers come from. And then finally, House America is a resolution that Regional Council passed in June that was really speeding up the timeline to get 770 folks 1,225 folks into rapid rehousing by the end of 2022, and then entering 300 units into the development pipeline. So I'll give a quick update on that as well. So changing how they reassessing temporary housing units, we started at 770. That number has been lowered to reduce homelessness by 25% to 462, mostly because of the work that has already happened with leading to the decrease of shelter beds needed. We opened the Washington Street shelter, Respira at the Human Services campus, iHelp in Peoria, thanks to a lot of the work of local jurisdictions. And we still have 140 units that have been committed by local jurisdictions that are set to open prior to 2027. But we also see this gap of 322 units that have yet to be funded. So we will be working with you all and the Regional Council on next steps as to how we get those additional units accomplished. On the permanent housing side, we see an increase. So we are continuing to see homelessness increase over time. As we just shared with the system flow dashboard, we are continuing to see numbers rise. So initially we had 1,225 units. That number has increased to 1,332. Of that, 1,249 units have been committed by local jurisdictions that are set to open prior to 2027. So we still have a gap of 73 units, but not quite the gap of the temporary housing need. During our last update in April, we shared over 2,500 units that have been committed since the beginning of 2021. And the reason for that decline is we've seen a lot of people already move into those units. So even some of these units are rapid rehousing units that are already on the market. We just haven't had people move into them. And a huge thanks to Threshold and the work being done by Threshold to be able to get those vouchers placed quickly and having folks referred into those units, even overcoming some of the barriers and rent costs that we see. So as I mentioned, still going to continue to see this need probably grow given the fact that we're seeing such an increase in homelessness. As I mentioned, want to keep you apprised of the progress related to House America. That the goals there were to rehouse 1,225 people experiencing homelessness and add 300 units into the development pipeline. At this point, we're currently 60% of the way through the challenge, and we've rehoused 68% of our goal and added 17% to the development pipeline. Many of the units that are in that development pipeline are being added through home ARP dollars, so we've yet to see those units come to fruition yet, but we anticipate to fully hit both of these goals by the end of the year with our current projections in place. Lastly, I wanted to talk about the coordination work that we are doing across Pathways Home. We've been working through developing a funding filter to really understand the breadth of funding dedicated to homelessness. So not only local jurisdictions, but state partners, private entities, foundations, how all of those partners are working together to address homelessness. We've also continued to work with Home Matters to Arizona and partnered to create an integrated regional public education campaign. That work has been vetted through listening sessions. There is one today at 3 p.m. if you all are interested in participating. And MAG serves on that core team and is continuing to work through all of that to develop this regional education campaign and then start to release it this fall. And then finally, wanted to share, we've recently been working on the initial stages of developing an affordable housing plan. We know we cannot solve homelessness without affordable housing, and that is in coordination with both public and private partners. So wanted to share that that is in the works. Finally, I wanted to share some information about how to stay informed and engaged. We have a series of meetings. These are all applicable to Regional Council and Management Committee and their staff. Anybody is more than welcome to attend. And we recently released a calendar on our website that is specifically looking at all of the meetings related to the continuum of care and your calendar. So if you are ever wondering, I want to attend coordinated entry and don't know when they are, those are all available on our website. And if you need an invitation to any of those, please reach out to us and we can get it over to you. And finally, I just want to be able to answer any questions that you all have on this presentation or about the work that we all are doing.
I don't see anybody's hands raised, but a lot of great work, Katie. So thank you for keeping us updated, keeping us informed, and keeping us moving forward. So are there any questions at all over the presentations from Ryan and Katie? And if not, then we're going to move into the next agenda item. Do board members have any action or discussion items for future meetings?
Hi, this is Joan. Just wanted to ask that the SRP canal conversation be added to the next agenda. And I believe Rachel Milne and or Scott Hall will be appropriate parties for that. And it's a good thing. I think they're at the NAH conference, so they wouldn't be able to be here today, but I think those would be the appropriate folks.
Great. Thank you. Ryan? You're playing Katie, you're on mute.
Sorry, thank you. I was going to ask staff regarding the SRP canal conversation. So that is a conversation that's happened with all jurisdictions, and we're all in conversation with SRP, and we all have our own action plans. I'd be happy to give an update on what the issue is and how it's being addressed, if it's appropriate at this time, if it needs to be put on the next agenda. I would just ask that, so every jurisdiction is handling it differently based on lots of different variables. So I would ask that if that presentation is going to come together, that it be a joint presentation, or at least the jurisdictions have a conversation with whoever's going to present it, so we give the full picture.
We can work on that, and we'll work on next steps.
Okay.
Madam Chair and Sir Co-Chair, may I add 2 cents since I was at the SRP meeting as well, just so we don't delay any further for those who are unaware. SRP is working with the Federal Bureau of Water Reclamation to prevent any individual from camping on canal banks. Currently, individuals have the ability to camp for up to 14 days because it is federal land, but they are trying to make it a special, they're putting through a special use permit of all 260 miles worth of canals in Maricopa County to prevent individuals from being able to camp there for a wide variety of safety and health reasons. They are standing up a support services location at I-17 and Indian School that will be available. It's proposed it will be available Wednesdays, where they will be bringing in targeted service providers to be able to try to help individuals who are coming off the canals to find both housing options and necessary support options. They've done quite a bit of research into the individuals who are out there at the moment, and there's a large flux in the number of individuals depending on the time of year. Right now, they have an estimated 70 camps with not a specific number of how many individuals are inside those tents. And so those 70 individuals are, they are guessing, CBI and Phoenix Rescue Mission are doing outreach currently. Many of those individuals are chronically homeless. There is a wide variety of other social supports that are needed, including substance use treatment for these individuals. They did reassure us during the meeting last week that older adults are being transferred with vouchers specifically dedicated to seniors right now. And they have had a couple families that were living with small children, and they were able to successfully find housing for those families as well. So these are primarily singles who will be affected by this, but I would expect that we will receive quite a bit of press on this, would be my expectation. I think it will not, I think there are loud homeless advocates in the community that will be very upset by this once it becomes public knowledge, and we should all be prepared to come at it with a united voice on what the proposed solutions are and how we're working to try to meet the needs of these individuals together. Thank you.
Great, thank you. Brian, your hand is still up. I'm not sure if you're good with another question.
Thanks, Rob. I didn't raise it again, but I do just want to say that, so what's the best way to say this? That report, Kelly, is very Phoenix centric, which Phoenix has had the most time and is doing an incredible amount of work with SRP to address this issue. Phoenix really jumped in with a ton of resources. The resource center that's being stood up is by Phoenix. And I would just say the rest of the communities where the numbers are being counted are also in Phoenix. And that's because the rest of us don't have as many people on our canals right now. And so we're very grateful to Phoenix for doing the level of service that they are doing. From a regional perspective, the rest of the communities, and maybe I should just speak for myself, but we're concerned that once it appears there is a 30-day notification period between August 1st and August 31st by SRP to canal campers, letting them know through outreach. Again, Phoenix has stepped up and they are, with their partners at CBI and other places, are providing that outreach. They are letting campers know that this ban that will start on September 1st is coming, but the ban will start on September 1st. The feds have approved that after the notification process. So it's a ban on camping and fires. All the signage is being changed, and it is now incumbent on cities, on jurisdictions to serve on their canals and on the mileage in their jurisdictions. And it is incumbent upon police departments to do trespassing when SRP calls. And so it's a heavy lift for, I mean, it could potentially be, it's definitely a heavy lift for Phoenix. It can potentially be a very heavy lift for other jurisdictions as well. And again, we're all really grateful for Phoenix for bringing us into this conversation, because it really wasn't being had too much with other jurisdictions. And so we're all doing our best to cooperate and come up with positive agreements, with SRP about how that will operate in each jurisdiction. But it is something new. There are varying beliefs about whether a special use, an SAU, a special use area will stand up to Boise versus Martin. So, you know, depending on what jurisdiction you belong to or what philosophy you subscribe to, you think it may hold up and you think it may not hold up. And so SRP strongly believes that creating this special use area where you can ban camping and ban fires will stand up to it. Again, as jurisdictions, we are doing our best to work with SRP to have a positive outcome to this and really to offer services to people and move them into, you know, better into services. But I do suspect there are going to be some challenges. Again, hats off to Phoenix for taking such a positive, proactive role in this. I know that we have been clear with SRP that we're happy to participate and happy to do the very best we can. We understand the importance of safe, healthy delivery of water to all citizens, but that if this does have unintended consequences, that we would be asking for, going back to the drawing board and asking for resources, potentially for additional shelter, for additional outreach, for additional cleanup, so that we can serve people versus just move people. So I just want to be
Can I pause
transparent.
You all? I very much appreciate this dialogue. This is not on your board agenda, so you all cannot continue to have this open discussion and back and forth because of open meeting law. We did not give a chance for public to weigh in on this either. So I'm going to take Joan's recommendation of bringing this forward next month to the board meeting. I think in the meantime, we can create a space for you all to have these discussions if that is something that interests you all. But we can't have back and forth dialogue on this item right now.
Fair enough, Katie.
Great. Noted. Thank you, Katie. So are there any other action or discussion items for future meetings that would like to be added to the agenda?
I'm going to add one more, sorry. I just, and this I can do during the next legislative update, but just that as the Lines to End Homelessness conference happening right now, they typically have a Capitol Hill Day that is that will be held virtually, and the Housing Coalition is playing the kind of state coordinator to manage those meetings. So that is scheduled for Wednesday, September 14th.
Great. Thank you. Is there anything else? Brian, did you want me to turn it over to you?
Sure, that'd be great, Rob. Thank you. So before we go on to comments from the board, I just wanted to let everybody know that unfortunately, this will be Jackie Taylor's last meeting. She is moving on to the retirement phase of her life. And so I want to congratulate you, Jackie. We are super sad to lose you as a board member, but I did want to let people know that officially, Jackie is turning over the reins at her agency, Save the Family, to Robin Julian on August 1st. And while she will remain around a bit longer, she felt it appropriate to resign from the board at this time, since she will be stepping down as CEO and trying to figure out how to go and enjoy retirement. Hopefully that won't be too hard for you, Jackie. But I just wanted to take a minute to reflect and maybe just share a little bit with you all about my special relationship with Jackie, just as a way of sharing how special she is to the community. I'll just share my story. So when I was like 28, I know that's hard for many of us to believe, given that I'm 48 now. So 20 years ago, I was a brand new social work graduate student, and my first internship was at UMOM. And Jackie Taylor was the executive director at that time, and she introduced me to a world that I only peripherally knew existed at that time, and ignited the passion for my entire career. just by her presence and her organization. And I had the distinct opportunity at that time to lots of great social work interns have come through UMOM. This was at the old campus on Van Buren, formerly home of the Sands Hotel back in the day. I actually dug up a Sands pen one day because I was back in the, what we at that time called the SRO, Single Resident Occupancy Program, which was sort of like, we didn't know it at the time, but the first chronically homeless specific programming. And at UMOM at the time, there was a back strip of rooms that was dedicated to that population. And I got to intern back there, and it was amazing and life-changing. And that's why I'm here today. And then, jump ahead a couple of years, and Jackie I am leaving the Arizona Housing Coalition, and maybe a couple directors later, I don't know, and Jackie is coming in. So not that we never lost touch, but we crossed paths again. And then fast forward, on and on and on. And Jackie has been in and out of my life as a friend, as a mentor, as someone who inspires me, and like literally started my passion and love for ending homelessness. So I personally am forever grateful to Jackie, just for her soul, for her heart, for her steadying hand and perspective and gentle way of approaching what is so complex and can be so, divisive is not the word, but when you get passionate, I know all of you feel this, when you get passionate in this area, as you just saw from my last conversation, you have feelings about these things. And Jackie always has a way of helping me stay level, bring it back, remind me that we all have a common interest and that we're all in this for the same reasons, and that every population that we all represent and every diverse perspective that we all come from still have the same goal, and to keep us focused on doing the important work that we do. And so Jackie has been so important in my life, in my professional life. And I just love you, Jackie. And I can't even, it's hard we'll have to have, other words, but it's hard for me to even really put into words how special you have been to our community, to me personally, to the continuum of care in your many roles. So I just want to thank you from the very bottom of my heart, and thank Jackie in all of this work she's done in all the different roles. She's always been involved in the continuum of care, whether as a board member, a committee member, an executive director, leading her staff in every way possible. So I just want to thank you, Jackie, and say how much we're going to miss you and how grateful we are in our community to have had you. For those of us who go way back with you, the impact Jackie has had specifically on family homelessness is second to none. So I want to say thank you. I want to allow you to a moment to reflect if you want, and anyone else who wants to add in. Thank you, Jackie.
Oh, Ryan, you're making me cry. Gosh, this has just been my passion for so many years, and I will never lose it. What an honor and pleasure it's been to serve with each one of you. And, I said in my resignation letter to you, Ryan and Rob, I left you out of my letter, and afterward I thought, oh my gosh, I left Rob out, and it was not intentional. But to work alongside you are all so smart and driven and caring. This is such hard work. You give me hope for the future. I will always stay involved because this is my passion, and I want to follow the good work and support the good work that you all do. Thank you for the opportunity to serve on this incredible board. When I reflect on my early days at UMOM, when we really first launched a continuum of care, yes, I am that old enough to remember that. I reflect on how far we've come, and listening to the reports today, and just the quality of the product that MAG as staff you've helped us develop. It's phenomenal. the journey that we've had as a continuum, and you will all be in my prayers every night so far, and it will continue till the day I die, to continue the great work that we have done in this community and that you all will carry on. And if ever you need me, if I can be of service to you in any way, I'm not quitting. I'm still living on. So please let me know if there's any effort or initiative that I can be helpful on. I care for you all so deeply. And thank you again for this opportunity to serve beside you.
Joan, I see you have your hand raised.
Just real quick, it seems fitting to be going after you, Jackie, and you, Ryan, talking, as I've always been following your guys' footsteps and trying to fill your big shoes that you guys have both left for me at the coalition. I just want to offer my thanks to you, Jackie. You are a family friend. I've known you since I was a kid. So I just appreciate all that you've instilled and imparted, all the wisdom you've imparted to me. And also you said gentleness, Ryan. There's been times when Jackie's almost come a little bit of a mother and said, "Oh, Joni, don't forget to do this and that." So I just really appreciate you, Jackie. I know this isn't goodbye, because, oh boy, howdy, now that you are retired, you're going to be number one on my policy committee, helping me advocate. So this is a thank you. Simply thank you.
Thank you, Joan. I figure now I can say all the things I couldn't say before because I might implicate my organization, right?
Yes. Are there others that would like to say anything? Okay.
Thanks
Well,
so
if
much.
not, Jackie, I hope there's going to be a couple more opportunities to celebrate you before you actually retire. So
I'm always good for happy hour.
Perfect.
I will just say, from a staff perspective, thank you so much, Jackie. And we have a certificate of appreciation. We'll be dropping by your office, probably not before August 1st when your new CEO starts, but I know that we still have a couple more months with you. So look for that coming your way also from the whole continuum and from us as staff.
Thank you so much.
Ryan, do you want to close this out, or should I?
Sorry about that. Yeah, I was being emotional. Okay. So, all right. Actually, it looks like that is our last item of business. Very fruitful meeting today. Thank you, staff, for all your preparation. Again, staff makes it seem so smooth and like these things just happen, but they are doing so much work behind the scenes, and not only staff, but all the committees that they're facilitating. It's all of you who are part of the continuum that are doing this work. I just want to recognize that, because none of the things we're talking about today are happening without tons of effort by all of you. So thank you very much. And everybody have a wonderful week. And with that, we are adjourned. Bye, everyone.
Thank you. Thanks, Jackie.